For my bacteria, I had Brucella abortus. For the makeup of Brucella abortus, it is gram-negative, rod-shaped, spore-forming. The domain of it is bacteria. It is aerobic, non-motile, facultative coccibacilli. The minimum exposure is 100 or 10 to 100 organisms to become infected, and it is catalase and oxidase positive. The symptoms of Brucella abortus is a fever that comes and goes, chills, loss of appetite, sweats, weakness, abdomen, joint, and muscle pain, and fatigue. So how does this spread? When you eat or drink something that is contaminated with a bacteria, such as unpasteurized milk or uncooked meat, it can also be spread through an open cut or scratch in the wound. This is common with veterinarians. Coming in contact with animal urine, blood, or tissue is another way this is spread, and that is also common in veterinarians. And then the least likely way to become infected is when you breathe in contaminated air. The most common people to become infected this way is in a laboratory testing this, at a slaughterhouse or a meat packing plant. How Brucella abortus is diagnosed. So the most common way is by a blood sample or a bone marrow sample. The least invasive but not the most common way to be diagnosed for this is by a urine test. Another way is a cerebrospinal fluid test. And further testing such as x-rays may need to be done to look at changes in the bones and joints. Some treatment options for this is if you start getting treatment within a few months of symptoms, it is curable with antibiotics. This is treated with antibiotics such as doxycycline and tetracycline. Antibiotics are taken for 4 or more weeks, and if this relapses, it may have to be treated with a different antibiotic if antibiotic resistance occurs. If this relapse, antibiotics need to be taken for 3 or more months to fully cure this. So, if you leave this untreated, there's several things that can occur. Encephalitis, which is inflammation of the brain. Lesions on the bones and joints, which is why they would need to do x-rays to see if they're changing or if there's new occurrences. Endocarditis, infection of the heart's inner lining. And meningitis, inflammation of the membrane around your brain. This can also cause infections in your liver, your spleen, bone marrow, and your kidneys as well. There are 4 types of Brucella. The first one is B. mellitinus, and this causes most cases in humans, sheep, and goats. B. suis is most commonly found in wild pigs. B. canis is most commonly found and spread by dogs, and B. abortus is most commonly spread by cattle. Some additional information about this is that not only can it affect humans, but it can affect cows, sheep, goats, horses, pigs, dogs, and several wild animals like deer, bison, elk, camel, and moose. In cattle, swine, and goats, this can be fatal. It can cause premature abortion in cattle, loss of milk production, weight loss, and lameness. There's a vaccine for cattle, sheep, and goats, but there's not a vaccine for humans yet. Since there is no cure for animals, their milk is tested 2 to 4 times a year, or they are tested by a blood test. In animals, incubation time can be 2 weeks to 1 year. And like I said earlier, there is no cure in animals for B. abortus. Some other information about B. abortus is in humans, the symptoms can start 5 to 60 days after coming in contact with the bacteria. Most people start seeing symptoms between 21 to 28 days. And some cases it can be symptoms can don't show up till a few months after being in contact. Just depends on the person. Infected mothers who are breastfeeding can also transmit the infection to their infants. Transmissions may occur via tissue transplantation or blood transfusion. This is extremely rare, as well as the mothers passing it through the breast milk. Most cases are reported in spring and summer months in Texas, California, Virginia, and Florida. And this is not commonly fatal in humans. Only about 100 cases are reported annually in the United States. But this is a huge threat in other parts of the world, such as Japan, Canada, and Australia, Mexico, Africa, India, and South Africa. It is reported by World Health Organization that in these areas there is more than 500,000 people who are affected with this disease each year. It's obviously a lot more than in the U.S. Symptoms improve or are gone in 2 to 6 months in humans. It does take a while. That's why you have to take antibiotics for so long. There are a few diseases that have the same symptoms and can get mixed up when diagnostics are being done, such as malaria and sometimes influenza. That one's not too common, but the malaria is very common to get mixed up with this. And how it was discovered and who by. So in 1886, David Bruce first founded this bacteria in a man who had died from Melata fever, which is the same thing. That is B. abortus. Then in 1897, it was discovered in cows. Then again in 1914 in swine. And then around the 1920s is when they finally renamed it to the genus to Brucella. So how to avoid Brucella abortus. Avoid consuming raw meat or unpasteurized milk, cheese, and ice cream. Wear gloves and protective glasses when handling animals or animal tissues. Cover any open wounds on your skin when coming into contact with animal blood. Wear protective clothing and gloves when helping animals give birth. Eliminate all infected animals from the herd, and vaccinate all calves that are born, and test any cows before merging them into the herd. These are pretty basic steps that usual people take, but just to be sure. And there's my works cited.